I wanted to talk for a few minutes about diet and its relationship to mental health. This is not to say that if you don't eat a healthy diet, it's going to cause mental health challenges, but we do have a strong relationship, and diet is an important factor in how we're able to feel and is what they call a modifiable risk factor for depression and anxiety. So the thing is this is a bidirectional relationship. It goes two ways. If we are having challenges with our mental health, it can lead to challenges in our diet. And if we have challenges in our diet, it can make our mental health worse. So trying to take that focus between our mental health and our diet and make it more positive is something that can be beneficial and help us to be able to be healthier and feel better. We can get into this kind of a negative cycle spiral where we're not feeling well mentally and we're not doing the things that would have our bodies be healthier because we're not feeling good mentally. And that makes us feel worse. And then we do less of those healthy lifestyle things. And then sometimes it can change our body's composition, how much we weigh, if we're losing or gaining too much weight. And that makes us feel worse too. So we want to break that cycle by making some healthier choices. So there's some big picture healthy plans. And one example is the DASH diet. Another example is the Mediterranean diet. And actually in some studies they used what they call a modified Mediterranean diet, which was including a few extra foods and some more lean proteins than is usually in that Mediterranean diet. But both of these patterns focus on lots of fruits and vegetables, whole grains, beans, legumes, fish, healthy lean proteins, and having just that overall healthy lifestyle made it so people had better mental health. So the people who improved their diet the most were able to feel better as far as their depression symptoms more than the people that only improved their diet a little bit. And the interesting thing is when they did a study with the DASH diet, they also saw decreased anger. And we don't usually think about that being associated necessarily with depression and anxiety, but it is. And having a decrease in some of that anger was helpful. With anxiety, there are less strong studies. Most of them are just taking a look at people and patterns. But they've noticed that people have less anxiety if they eat a diet that is higher in fruits and vegetables and whole grains, lean proteins, nuts, and legumes. And people have more anxiety if they're eating more processed or fried foods, refined grains, sugary foods, things like that that are going to have less vitamins and minerals, what we call less nutrient-dense foods. Another thing that seems to make a big impact is including foods that have what are called omega-3 fatty acids in them. And these are a type of an unsaturated fat that is found in foods like walnuts and fish. So your walnut crusted salmon is a great choice to get some of those omega-3 fatty acids in. But they've noticed that there's a reduced risk of anxiety the more of those fatty, oily fish and nuts that people are consuming. And this can reduce that risk of anxiety pretty substantially, up to about half. And then with depression, if you're trying to prevent depression or have some just borderline symptoms and challenges, just including those omega-3 fats in your diet is going to be helpful. Whereas adding a supplement can be important if you're trying to treat depression. And so talking to your doctor or therapist, dietitian about including that in your diet if you're dealing with trying to treat depression is important to be able to get an appropriate dose.